Now, okay, good morning. I'm Dr. David A. Paget, and this is the Tennessee State University Geographic Information Systems Day event. We are going to have several of my students present their research project, or one of their research projects for the semester, during which they use geographic information systems to analyze the vulnerability of urban populations to COVID-19, a very timely project. And so the 5 cities are Gulfport, Mississippi, Houston, Texas, Mobile, Alabama, New Orleans, Louisiana, and Pensacola, Florida. So just to give you a little bit of background, the reason that I chose these 5 cities is that they include communities that we are working with, we meaning the Deep South Center for Environmental Justice. We are working with as part of the community-based organization Gulf Equity Project. Again, that is directed by Dr. Robert Bullard and Dr. Beverly Wright, 2 people that you can Google. So the way we're going to proceed is that I'm going to ask you some questions, and then you will manipulate the map to answer those questions if necessary. And then I'm going to open it up to the audience. And in the audience are, again, members of the communities that we are working in right now. And so you are to be commended. Your work on this project is going to help these communities. So again, I don't ask you to do busy work in my classes. You do work that's going to help people. Our motto at TSU is think, work, serve. So you had to think about this project. It was a lot of work, and you're going to provide a service to people that you will meet today. So the first question, and when I ask you a question, introduce yourself, your name, major, where you're from, just basic information about yourself, and then answer the question. So any of you can answer this question. When you first ranked your cities in terms of vulnerability to COVID-19, so the students first had to rank these 5 cities just based upon no prior information in terms of what they thought would be the most vulnerable population to COVID-19 to the least. So what was your original ranking? Anybody in the group?
Is it okay if we pull up the file real quick? Because we did all have it on one sheet of paper we need to pull up.
Yes, absolutely. So while they are doing that, let's see. Well, while they're doing that, Reverend Avant and Pastor Greer, would you mind introducing yourself to my students? Let them know who you are and what you do with the Unity in the Family Ministry.
Hi, I'm Reverend Calvin Avant, pastor and executive director for Unity in the Family Ministry. And as a part of the HBCU CBO Gulf Coast Equity Consortium, we work with communities Wedgewood, Rolling Hill, Outer Heights, who have 11 unlined toxic landfills in their community. It's been there for approximately about 30 years. And we're working to try to relocate and remediate that area. Pastor Greer.
Hi, good morning. I'm Pastor Greer, Timothy Greer, Pensacola, Florida. I work with the Deep South Center for Environmental Justice in conjunction with Dr. Avant here at Unity and Family Ministries. We are involved in, as Dr. Avant mentioned, remediation and relocation in those communities. I work along with a couple of other people that are involved in the community with the Homeowners Association. And our responsibility is to assess information or collect data that affecting that particular community, could be air quality, water quality, soil quality. We work closely with the homeowners association, so they kind of reach out to the community, collect data from them as far as what they may need, what their concerns may be. One of the things that we've been interested in looking at was this flood damage that just occurred from Sally. A lot of the homes that got flooded out during that storm. A lot of the pits and stuff that you might see, I don't know if the students had a chance to look at the 13 landfills and I guess you can say C and D pits and stuff of that nature that were flooded from the last storm that we had. How much of it got over into the people's yards and how much pollution as far as contamination of the water supply. A lot of different things that took place during that storm. So we assessed who was affected. We kind of got out there and seen what was going on in the community. Work closely with the emergency management. We find out people who have been lost power in the area, the ones who might have gotten flooded, the ones who have lack of food in that area. So I work alongside the emergency management as well. So we kind of pulled everything together as far as what Pensacola is doing. People that are boots on the ground, so to speak, the people that know what's happening, don't know what's happening. We make sure that we are inform them and let them know, okay, well, we need food in the Wedgewood, Olive Heights, Rolling Hill community area, or we got power outages in those areas. And that gives the local power company information that they need to go out and restore power. The ones that don't have food, we have American Red Cross, we have the Salvation Army. They go out and displace food in those areas. So we kind of have a kind of a bird's eye view of what's happening, and because we're working with the Black and brown communities, we are able to direct things that they need in that community. If it's food, tarps on their homes, we kind of gotten involved with the emergency management so they know that we are on the ground and we are working with people in those various communities. So I'm glad to know that TSU is working on some things that might help us continue to work with the Wedgewood community. I thank Dr. Padgett for inviting us to be a part of this GSI Day. I'm looking forward to hearing what the students have put together for us.
Okay, thank you very much. I think that we're ready to go. And so do you have your, I mean, I have your rankings, but so what was your original ranking based upon no prior information of cities most vulnerable to COVID-19 to the ones that you thought was least vulnerable?
Okay, I'll go ahead and answer this. So initially we thought that Pensacola, Florida was going to be.
Excuse me, you are. Please.
Kima Craft. I'm sorry. My name is Kima Craft. I'm a freshman at Tennessee State University with a major in architectural engineering, and I am from Los Angeles, California. So for this project, the rankings that my group and I had initially were first Pensacola, then Houston, New Orleans, Mobile, then Gulfport. So initially we thought that Pensacola, Florida would be ranked highest because we assumed that Florida has a high population. There's a lot of people who have a lot of different beliefs. So we just thought that possibly they would be ranked the highest. And then from that point on, we just started analyzing what we think would cause them to be ranked this way. So if they want to go ahead and chime in and say their reasoning for the next couple too.
Yes, my name is Tradarius Durden. I'm from Memphis. I major in mechanical engineering actually. And when we first started, like when we started ranking, we do like based off prior knowledge of like basically what we already know of the city. So, you know, you think that the higher the population is, the more COVID would spread or be able to spread. So we basically ranked them in that order. So the more people, you know, like the more population, the higher the population is, then like as you can see now, when you go to actually looking at data and all that, the COVID number actually are high, or the COVID numbers are actually higher in higher populated areas. So that's how we ranked them.
Okay, thank you, very much. And yeah, I was attending to someone who texted me who's trying to get into the meeting. Tradarius, I didn't hear. Did you introduce yourself?
Yes, sir.
Oh, okay. Just making sure.
Yeah.
Okay, so now we're going to move on to the second ranking of cities. So I know your first ranking, you had Pensacola, then Houston, then New Orleans, and then Mobile, Alabama, and then Gulfport, Mississippi. And so I'm going to scroll down here, and now I see so what they had to do was they had the initial ranking, and they used this GIS to look at several variables, which we'll talk about later. And then after examining the variables that are indicators of population's vulnerability to COVID-19, they came up with their final rankings. So what was your final rankings after doing the GIS analysis?
After doing the GIS analysis, our final rankings were Houston, New Orleans, Pensacola, Mobile, and Gulfport. So basically, after we got all of our data gathered and actually found the actual stats of the areas and which areas were higher populated with COVID, then this were our final stats, which was it kind of threw us off a little bit because, we expected what we at first thought was going to be that. Kind of threw you off. It kind of surprises you. So this was our final rankings right here.
Okay, in terms of, so what was there one variable that really pushed Houston to the top? What was that variable?
Well, I know the primary variables that influenced our new ranking and conclusion had a lot to do with social vulnerability index. Like with COVID-19 being airborne and social distancing being like a major catalyst in the spread of COVID, we deduced that it would be most sensible to depend primarily on population, race, and age. So it was all based on an accumulation of all the data that we had.
Okay, so who has the map control?
Tradarius.
Okay, Tradarius, can you please change the symbology on the map to show the social vulnerability index, not the base map. Yeah, go to, yeah, there you go, right there, and then okay, just go, no, don't do that, I mean, don't do that. Let me explain what is happening. So yeah, your data is on there. So just don't worry about changing anything on there. Don't just don't change anything there. I included your data into a larger map that's going to be used by the community-based organization. So there are multiple layers on this map, but your data is at the heart of it. So just go to that little, see right underneath, to the right, to the left. Sound like I'm doing electric slide. Up a little bit. Okay, down. See that little thing that looks like a triangle, circle? Yeah, there you go. All right, now you probably remember. Yeah, they did this. So change the attribute. Click on it to, okay, now you probably. Wait a minute, get out of that for a second, please. Okay, go back to close that. Just hit done or cancel. Close that. Okay, scroll down all the way down. Keep going.
That's crazy.
Okay, see where it says DSE, Deep South Center? Okay, click there. Okay, that's your data. Okay, Okay.
Yeah.
Okay, there you go. Now it should start looking familiar. Okay.
Yeah, I was wondering.
Yeah.
All right. So what'd you ask for again?
Social vulnerability index.
Okay. Yeah. Now that looks better. I was wondering.
Okay. Yeah. Okay. There we go. And then you can hit done.
Yep.
Okay. And then kind of zoom in a little bit because it looks like keep going. Zoom in. Okay. Okay. So Can any of you, do any of you all remember? I know they did this project a while ago. I mean, like
Yeah.
literally in the middle of the semester. And so do any of you all remember what the social vulnerability index is? I know it was a while ago,
Yeah, I probably have to go back and.
but you all have, young brains.
Post it- post
You all
that
know
in
what
the
you
screens
all
and
know
post
what a senior moment is. Okay, I'll just well, the social vulnerability index is an agglomeration of indicators of vulnerability, such as, say, poverty rates, um, race in some cases, numbers of income, and a variety of other indicators that are drawn largely from the U.S. Census Bureau. Really, there in the original Social Vulnerability Index, there are 28 variables that come together to make this index. And the reason that we use an index is that if you looked at 28 different variables to determine whether one community is more vulnerable than another, it would be almost impossible for any human being to do that. But if we look at the relative vulnerability of one place versus another and assign that a number, so let's say the place that has the highest poverty rate would have a score of 100. Okay. So if there was another place that had half the poverty rate of that highest city, that would get a score of 50. And then you take other variables, add the scores together, and then you get this index of vulnerability. So that's what the social vulnerability index is. And this is very interesting. Let's look at Pensacola. Did that surprise you that in terms of social vulnerability, Pensacola's population is that less vulnerable in general to the other cities?
Yes, sir. It did.
Yes,
Yeah, it really did surprise me.
it definitely surprised us because in the beginning, that's what we initially thought would be the most vulnerable because we assumed Florida has a high population, but that specific area didn't actually have a super high population.
Yes, exactly. Yes. So you said that. So the scroll out. I mean, zoom out a bit so we can see the full. Okay, so it looks like New Orleans act. No, wait. It's like looks like Mobile actually. Click on Mobile. Click on the Mobile, Alabama point symbol. No, actually, it's Gulfport. I'm sorry. Looks like Gulfport, Mississippi, has the highest social vulnerability index of 0.86. So you could say that's 86 out of 100. So if 100, if a Soviet 100 is the worst city in terms of vulnerability, not just to COVID-19, but period, then Gulfport, Mississippi has a score of 86. So that just gives you an idea of what's happening just in general in Gulfport, Mississippi. And this same data are used not only to determine vulnerability to COVID-19, but vulnerability to, say, a hurricane or any other natural disaster. Okay, so what was another? So Sobe was one of your variables. What was another variable that really pushed Houston to the top? Besides the Sobe. Yeah, so what was another variable that influenced your final ranking?
The percentage of like the different races that were there, because we know if there's a high population of minorities, we normally have more respiratory issues, which can impact your health and cause you to, get COVID-19 or be more susceptible to getting it.
yes, we know that African Americans are significantly disproportionate in terms of infections, in terms of deaths. I mean, so could you please change the symbology on the map to show the city's African American population? Okay, could you bring the legend back in? Just click on details and click on legend. So legend, okay, there you go. So now we have, so there's a wide range of percent African American population in the cities. Um, okay, well, Houston looks like Houston has the lowest percent African American population as compared to New Orleans. So could you um, explain why, even though, what were your thoughts about this when you saw this map? Were you surprised?
Oh yeah, actually. Now that I'm looking at it, I really feel like our rankings could be actually off a little bit now, because it's really leaning more towards New Orleans a little bit because of the population.
Yeah.
So,
I think the biggest disparity is probably the percent over 65. That's pretty much what kind of made Houston at the top of our rankings because of the it's a higher risk over age when with the elderlies, there's a higher risk of them getting COVID-19. I think that's our biggest disparity.
Okay, so we're gonna look at population over 65 years of age. Hit done. Yes, done. Go back to the legend. Oh, yeah, bring the legend back. All right. Okay, there we go. So percent over 65. Well, Houston. That's interesting. That Houston. Well, first of all, just to give you the context, the average large city in the United States has about 12% of its population over the age of 65. And so Houston is apparently a relatively young city compared to the other ones. And we know that the death rate to COVID-19, just for everybody over the age of 65, is about 80%. And so that's where the majority of the deaths are, and probably hospitalizations and everything else. And that's simply due to the fact that as we get older, our immune systems get weaker and make us more susceptible to COVID-19, influenza, and what have you. It's just, as they say, Father Time or Mother Nature is undefeated when it comes to that. So, but what about population? Let's look at the population of each city. So change the map to just population for the cities. Okay, now what do you think now that you look at it now? So does this make things a little clearer?
yeah, that actually
Yeah,
makes
it really does.
yeah, with the population being
Population is the
higher.
biggest factor.
Yeah, I believe I believe Houston is the fourth largest city in the United States. I think it's New York, LA, Chicago, then Houston. I think I'm pretty sure of that. So Houston's a very large city, and so even though Houston's African American population or population over the age of 65 is, of course, lower in terms of percentage, but in raw numbers, because Houston is so much larger than those other cities, there's just more of those at-risk groups to have to deal with. And so this is where we have to look at our data and ask some questions and go back and forth. So speaking of asking questions, I'm not going to ask any more questions. I'm going to open it up the questions to the audience. And again, we have, if you're from a community-based organization, please again, make sure that my students know that I see Major Womack is here for sure. And I saw Simone English also. So I'm opening up. Let me see, are there any questions in the chat? Okay, are there any questions from anybody? You can either put them in the chat or wait, oh. Okay. Any questions for the students? Please ask some questions. They're ready. They're ready.
I just wanted to say something too.
Oh, sure.
We also took the stay-at-home orders into consideration as well. Like cities like Houston, Pensacola, and New Orleans, they've been far more lenient with their stay-at-home orders. So we just took that into consideration as well. And we figured that cities that had, older folks living there would be more vulnerable to it, unless, of course, they gave the option to let older people go in the morning, like into grocery stores, or have these windows where they're able to do shopping on their own time. They're not as vulnerable to getting the virus. So that played a role as well.
Any questions?
Yeah, this is Clement. Can you hear me?
Yes.
Yeah, this is Clement Akumu. Sorry, I joined your presentation a little bit late. I thought it was tomorrow or so. But I wanted to ask the student, did you guys allocate weight to your vulnerability data? And if you did, how did you do it? And so how did you do if you allocated weight, and how did you do it?
Oh, I guess did they weight the data?
Yeah, did they allocate any weight in the vulnerability analysis to the variables?
No, Dr. Kuma. Yeah, Dr. Kuma is another one of our GIS and remote sensing specialists at Tennessee State University. The procedure was I gave, well, let's do this. Who is Tradarius? Do you have the map?
Oh, yes, sir.
Could you open up the attribute table? So go to details, and then go to your content, and then you scroll down and open up, and then to the left, right to the there, to the other right there. That's the attribute table. So just can you pull the attribute, expand the attribute table? Just take the cursor, move it right, down, up a little bit, right there, right. See where it turned into a little arrow. Whoa. Yeah, up right there. Now drag the attribute. Whoa, yeah, there you go. Then you can just stop right there. So these are the variables. So it's population density, population over 65. Keep scrolling across through the percent Black, percent Latinx, percent in poverty, the social vulnerability index for each city, the percent with asthma, percent unemployment, and exposure to PM 2.5. So I actually gave the students sources. So they actually had to go in and pull these data out of the census.gov site, out of the Centers for Disease Control website, and other verifiable information sources. And it was an exercise in conducting research, gathering primary source data. Our students, they just want to Google everything. Like, no, you can't. Somebody asks you exactly this is the question. This is the question I told you will come up. Somebody's going to ask you, where did you get these data from? And further, Dr. Kuma was asking, did you weight the data? So weighting would be, let's say, if we really thought that the percent over 65 variable was the most important variable, then we might take that indicator and maybe multiply it by 2. So we would say for every city, we'll make that variable weight heavier. I'm simplifying this a lot. But the answer, Dr. Kuma, is no. This is the first time these students have probably ever used GIS, and a lot of them are first semester freshmen. And it's amazing that they were able to do this in spite of COVID, being distant, and all of that. And so, yeah. So I wasn't going to be like, can you wait the very, no. I'm very happy with what they did here, given that they're completely new to GIS. Okay, I think.
Yeah. With this,
Yes.
yeah, I was about to say I would add on to that with this assignment. I have never even experienced GIS or have even messed with like just geography period. But not being able to just go straight to Google and having the actual fish and just go actually search around for the information and do in-depth search for the information. It was kind of interesting to me and opened my eyes up to some new technology and new sources to use when it comes to finding things like this, because stuff like this actually can come, well, it has become interesting to me because it's a lot of stuff that I didn't know, and it's a lot of things that's eye-opening to me as well.
Well, thank you for that. There's a question from Joshua KK, who's joining us from Nigeria. So I told you all you're going to be presenting in front of a worldwide audience. I wasn't joking around. Joshua, if you have a question, please ask it.
Okay. Wow. Your students are doing wonderful, and I'm really impressed. I'm even considering replicating such research in Nigeria. However, I just wanted to, mine is not really a question, but it's just a suggestion. If they'll consider increasing the classes, that's the group, from 5 to 6, because the way it is now is it can be very difficult to like deduce the numbers, to interpret them from relate the numbers from with what is on the map, that the symbol on the map and the groupings, the classes on the legend. So that is my suggestion. Thank you.
Oh, so you're saying that we should have more cities?
No, more groups. Maybe you can increase the group since the figures are large. Yes.
Oh, yes.
On the legend. Oh, yes. On the legend. The symbology on the legend, maybe to 6, because it's 5 now, I think.
Oh, okay. I understand what you're saying. Yes, that's a very good comment. And I did discuss that with the students in terms of the and I cannot see this is what I mean by a senior moment. I cannot think of the word. But basically notice that the range goes from 52,975 up to 2 million or so. Now, for this map, the range in the data is okay because it really, you really want to show how much larger Houston is than the other cities. Is it proportionate? In this case, yes. Let's look at another variable that might. Let's look at asthma rates. So bring asthma rates up, please. This was a good example of a variable that. Okay, so notice that the difference here is only between the high and the low is only 3.2% between the city that has the highest asthma rate, which happens to be as I believe Pastor Greer pointed out, Pensacola, Florida has the highest asthma rate amongst these cities at 11.5%, and then Houston has the lowest at 8.3. Now, looking at the map symbols and not paying attention to the data range, it gives the impression that asthma is far worse that's Mobile, I'm sorry. Far worse in Mobile than it is in Houston, but it's only a 3% difference. And the average city in the United States has about 10% of its population. These are adults. This does not include pediatric asthma. But these are adults with asthma. So, and this is why we have to look at the context also. So probably what I believe Joshua was saying is that we should perhaps have our symbology be proportionate to the data so that we don't, I guess, misrepresent the data on the map. And so, yeah, I did definitely discuss that with the students. Does that answer your question? Did I address that? Or? Oh, he said exactly. He said exactly. So, yeah, I mean, and that's one of the, this is the cartography part of the course I was talking to the students about. Cartography is the art and science of map making. So it's one thing to be able to manipulate the GIS software. It's an entirely different thing to understand, how those data appear on the map, and are you giving the viewing audience an accurate picture of the data? And you can manipulate the data, as you can see. It's easy if you had an audience that really wasn't knowledgeable of the context of asthma, that didn't know how asthma is, what the percent of asthma is among adults in cities. It's the average is about 10%. If your audience didn't know that, and you wanted to convince them that asthma is awful in Mobile, Alabama, this is exactly how you would do that. But you don't want to do that. We don't want to do that. But that was a very good question. Thank you for asking that. Let's see. Any other questions, please? Questions? Pouring in.
Hurricane season, your data after going back and looking at it again since we've been affected by all these hurricanes.
Yeah, Reverend Van, I didn't hear the first part of your question.
I said, because we've been affected by so many hurricanes over this hurricane season, would that change any of the data by virtue of what we've got, what the communities have gone through?
Yeah, well, students, what do you think? I'm not going to answer. I could answer that question, but I'll let you all give it a shot.
Tradarius, can you pull up all the components again that we used? Based off the data that we had to collect, I don't know that natural disasters would actually affect the vulnerability. I don't think it would actually play a role, because I don't know, if anything, would that lead to people social distancing more? Would that lead to people being in the house more as opposed to going out if natural disasters are hitting?
I think that with hurricanes and all that, like, depending on how bad it is, I mean, as far as our data goes, it might affect population and might make some change there with population, because you have casualties, they might happen, people might die off, or just anything could happen with hurricanes. So with that, I mean, people would be forced to, I wouldn't say to be, well, I think numbers probably could go up. Then more people have to go to the hospital and have to get closer together and become, more open to COVID, in hospitals and all that stuff, because of people possibly getting hurt. So the numbers with COVID might actually go up. It might spike a little bit, and could possibly go down too, because of the hurricane. Like, just, you're not gonna have normal. Let's see, what am I trying to say? You're not gonna have the normal of people being around each other and all that. But again, with it hurting people, it possibly could put people closer together with being in hospitals and all that, and making them more open to COVID in hospitals.
I also think the poverty rate would have probably increased because the homes are being damaged and all that. So many people are losing their homes, and their families are, off and wandering on the streets due to the natural disasters.
Yes, sir. That is true. And unemployment too possibly could pay, because it might knock down somebody's business. They might not be able to go back to work because their business isn't there anymore. So that could play a big role with hurricanes doing the damage that they do. It could play a big role. So I think so. Yeah, it could change a lot of data. You have to go back and recalculate everything and regather some information from the cities and stuff that we have collected here.
Yeah, it had some noise here. Oh, thank you. Good job. I could hear the questions being answered. So we had Reverend Van and Pastor Greer introduce themselves. We also have from Mobile, Alabama, and the chess organization, Major Joe Womack. Major Womack, would you mind introducing yourself to students and your involvement with the community-based organization project? Yeah, Major Womack. Oh, maybe that's who texted me. Okay, that must have been who texted me.
Dr. Paget, this is Chris Williams. Major Womack has been having some computer problems, so that may be why he's not responding.
Okay.
Yes, it shows that he's in the call, but
Yeah, I see him.
having
I
issues.
think, yeah, that might be. Yeah, I have a new phone, so I don't. All my contacts are. Let's see. Hey, well, we also have Simone English, who is also working in Pensacola. Simone, would you mind introducing yourself?
Greetings, everyone. Great work, students. My name is Simone English. I'm a PhD candidate at Florida A&M University. I'm in the School of the Environment, and I work along with the Deep South Center for Environmental Justice. And my research is on community resilience. Thank you, Dr. Paget.
Yeah, Simone, could you go into more detail about what community resilience is and explain perhaps how this map the students made could perhaps assist in that task or function?
Right. So usually, when people talk about community resilience or resilience overall, it's bouncing back. But the way I want to look at it, it's bouncing forward, because the existing situation, which is what your map is showing that they're already vulnerable. So we wouldn't want to bounce back to this situation after COVID or after a natural disaster. So a map like this tells us where the areas we would need to do work in, what resources we would probably need to provide to the community. And like for the last question that was asked, by Dr. Evant, would the hurricanes that they just went through cause a difference in the map? And it would, in the case where people would have to evacuate. There was a lot of hurricane damage to properties in Pensacola. So again, that would make some people poorer, right? Some people would now need to find somewhere else to relocate to for the moment. People now probably would be bundling together that wouldn't be bundling together, putting themselves at a higher risk of COVID infection. So this map is really, really good in terms of community resilience and looking at what is there now and what we would need to look at for them to be able to face disasters and pandemics better in the future.
Yes, thank you very much. So we have FAMU in the house. So let's see. I had a question and I was going to.
I think you got Joe back.
Oh yeah, Joe actually, yeah, he texted me and said that he can hear us, but he can hear us, but he doesn't have sound. So I'm going to try to get him to introduce himself in the chat room. But yeah, either Reverend Avant or Pastor Greer, you mentioned the impact. This has been a record-breaking tropical storm season. How has COVID vulnerability or COVID-19 issues affected you all in dealing with these hurricanes there in Pensacola?
Okay. Well, job situations have been affected because of the fact that they closed down a lot of the restaurants, and because of the bridge that we have going from Pensacola over into Gulf Breeze. I don't know if you've been following where the Skansa barges had gotten loosed and tore the bridge, a section of the bridge out. So that affected us as well. So that caused Gulf Breeze to be kind of landlocked. In Pensacola, the people that were working on the beach, they couldn't have access to the beach, so they have to go Highway 90 around instead of using the Highway 98, which is the bridge that they were using to go over into Gulf Breeze. So a lot of folks who have been displaced as far as jobs are concerned. The storm also created a problem with housing, because so many of them during that time frame were out of power, no power. And because of the fact that it affected the time for getting power back into some of those communities, it went almost from maybe 2 to 3 days to a week. Some of those places didn't get power. And then the homes that the power lines connecting from the pole to the homes were severed. So it took even longer, because the way the electrical system is set up, you have to bring an electrician to tie the pole, the power from the pole to the house. So Gulf Power would not do that. And so a lot of other homes were affected. People still lag behind getting their power back. So that created a burden on them, as far as, say you had food with refrigeration, deep freezers and things like that. They may have food stored. A lot of that stuff was spoiled. So a lot of those places were affected because of the storm. Flooding, I mentioned that earlier in the introduction. We had some areas that flooded. Now, when we did our GSI, Dr. Padgett, when you were here in Pensacola, we laid out all of those pits, and quite a few of them flooded. And when they flooded, that meant that the water table rose above and went over into folks' yard. That created a problem, because now they had flooding on top of all the other issues they were having. No electrical problems, flooding, all kind of things were going on. So Sally really impacted Pensacola a great deal. Now, if you look at the COVID coronavirus reports that we're getting from Ms. Wright from out of the New Orleans, you see our COVID numbers are starting to spike. They're starting to go up for Escambia County now. Your students probably don't have access to a lot of this, but when you talk about Escambia County, Santa Rosa County, the different counties, Walden counties, you start to see Pensacola, which is Escambia County, growing. So it affected us quite a bit, because we do have, and I hate to say it this way, but we do have some knuckleheads here that don't want to wear masks. And because of that, it's spiking. Not to say that Mobile has anything to do with it, but you know, we're only 54 miles from Mobile. And I noticed when I look at the dots here, it shows, I guess this is the one on asthma. Pensacola, notice Pensacola wasn't listed as asthma. I don't think they had any numbers for the asthma, but one of the problems that we were having in Pensacola, and I think Dr. Paz, you probably remember Rolling Hill, Olive Heights, when we did the health assessment, we had so many people out there that had COPD. We had people that had one lung, where they had lung cancer, surgery that were taking place. People were dying just about every week or every month. There was somebody dying because of the pollution that they were already dealing with the silica dust and the hydrogen sulfide. So now on top of that, you throw COVID, and you just kind of got a cocktail mixture there, and all kind of things are happening. So yeah, we've had a tremendous amount of deaths here in Pensacola during this pandemic, and other conditions, heart attacks, you name it, it's affecting Pensacola. So I didn't see those numbers. I might have missed it.
You mean for the asthma?
Yeah, for the asthma.
Well, actually, the database that the students accessed did not include data for asthma for Pensacola. I tried to drill down to the Florida Department of Health. I couldn't find it. I mean, even though we like to have all of our data come from the same consistent source, but sometimes this happens as you in research. So in this case, the Centers for Disease Control 500 cities database that the students accessed was for the 500 largest cities in the United States. Apparently, Pensacola isn't in that number, and so that's why that data point isn't there. But what I wanted to ask the students, or who Tradarius, if you have the control of the map, one of the variables that when Pastor Greer first started talking, he talked about people losing jobs and so on and so forth. And so that is another, that meaning unemployment is another variable that we looked at, that we included in the database. And so if you can bring the legend back up and I guess pull, scroll, drag it so that Houston gets in there. Yeah, just drag it across. Yeah. Oh, yeah. Or yeah, there we go. Yeah, that's perfect. And so now this is an interesting map. I am going to ask the students a question related to what Pastor Greer just said. So here we have unemployment. And so again, we have to look at the context. So notice that unemployment ranges from 6% to 8.5%. Prior to COVID-19, the unemployment rates were relatively low. I'd say 2 to 3%. Now, this is overall unemployment. We're not talking about Black unemployment, which is a different thing.
Right.
That's a whole other different situation. But so these unemployment numbers are an exact or direct reflection of COVID-19 in that they're rivaling the numbers of the 2008 recession when unemployment rates went up to 10 and 12% and people were in a panic. But we've looked at cities all over. I've have 4 other student groups that did this assignment, and some of the unemployment rates in Detroit, say, and some cities are 20%, 23%, Las Vegas. So I guess I might already answer the question, but to the students, unemployment is not a health-based variable. So why do we include unemployment? Probably talk too much, but why do we include unemployment with this pandemic in terms of vulnerability?
Well, unemployment plays a big role with people having to be out, and unemployment also leads to people actually becoming homeless sometimes and being out more and being more open to COVID and not having access to buy masks. And so if you're unemployed, you actually don't have the funds to buy masks and all that stuff. It plays a role in having COVID. Unemployment leads to, like, again, homelessness, people being out and around. And in my opinion, I believe most of the, like with the unemployment with COVID, how they made the unemployment numbers, like the payment for unemployment people, the numbers went up. So I think that some people were like, oh, why would I work if I can just sit at home and get paid this amount of money every week and be fine? So some people, it's just that lazy, the laziness kicking in, like, no, wow, if I'm going to working every day and I'm not even making as much as these people sitting at home unemployed and making a killing. So some people, just leave their jobs, and some people actually become sick and actually have to stay off and lose the job because of COVID. So that plays a big.
I wouldn't say that might not necessarily be lazy.
Yeah, I wanted to mention that too.
But just think about it. What else happened what happened with the schools when COVID hit? What happened?
Closed down.
So think about it. Here you are, you're a parent, right? Your kids are at home. And where do you have to be?
At home with your kids.
And
you don't have a choice, really.
So you have to be home. And if unemployment is paying you more than you would be making working. I mean, why would
Unemployment is sensible.
you might not be able to leave your kids home. So it's not necessarily people. Yeah, there might be 1 or 2 people out there that just truly are like kick back, get the check. But a lot of people needed that money because of the situation. And I'm going to follow it up with another question in terms of unemployment. Who is unemployed? Is everybody unemployed right now?
No.
Who
No,
is
not
unemployed right now? People in what industry?
The non-essential ones, like maybe barbers,
Restaurant.
restaurant workers.
Let's see who else plays.
Keep going.
I want to say if there's anyone who's lazy and
Could
on
be teachers.
unemployment, it's probably teenagers. Because I know I'm on unemployment because, like, I could technically be out there. I could be working at McDonald's and I could be okay. But realistic, it just kind of makes sense for me. I don't know if that is considered laziness, but for a lot of people, it does make sense to be at home on unemployment, be with your kids, and staying away from the virus if possible. And this also just goes to show that data needs to be updated constantly because it's all just cause and effect. Like so many different things can affect what's going on and how susceptible people are to getting COVID.
Yeah, the employment and unemployment question, I mean, exactly. Think about it. I mean, I had COVID about a month ago. And when I tested positive, I was thinking, well, what if my family was dependent upon me to work?
Oh, yeah.
I mean, so I know I'm supposed to quarantine, right? But what if when I quarantine, I lose my job? Now my children can't eat. I mean, there's people, that's a real decision, right?
Yeah.
But but the last question I'm going to ask is, are there any other variables you think that, you know, we only gave you about 14 or 15, but besides asthma, exposure to particulate matter 2.5, are there any other variables that you think we could have included in this data set that would have made this analysis even richer?
Let's see. That would play a big role.
When was this data
We could have.
collected?
Oh, excuse me, Pastor Greer.
Question. I wanted to know, when was this data collected? Back in March sometime, or when was it? When they were doing their research, when did they collect this particular data?
They did this semester. This was just one of their assignments. You know, this is Dr. class. You know, so,
Yes, sir.
so
was that before Sally or after Sally?
When did Sally hit?
Should have been recent.
In October.
October?
Yeah.
Okay.
That was around the same time.
October 5th.
In terms of the data, all the data sets have different. So the social vulnerability index data were probably for 2016 or 2018.
Okay.
Now the unemployment data, that's updated every month. So that's pretty current. The census data, of course, are probably from 2019. So you're not going to have an exact time match for all your data sets, but if they're within a reasonable range, then that's fine. But yeah, but something like unemployment changes from month to month, especially now. So you really have to have that is released current. That's a very current data set that's released by the Bureau of Labor Statistics. But obviously the census data is collected. Well, you have the decennial census every 10 years. Then you have the American Community Survey that's pretty much collected as a sample all the time. So, but the students actually in their collection of the data, they did that this semester, but they had, like I said, no control over when the primary source data were collected. Yeah.
All right, to answer your question though, I think that homelessness, like the population or percentage of homelessness in each city, probably would have played a big role too, because you know you got homeless people that's out there that don't have the access to everything we have access to, masks, being able to go home and social distance. They actually out and being out in the open all the time, so that could spike the numbers up, and they're not going to get tested. So like you really can't use them either, because they can't become a stat of, you know, you can't put them down as a stat of having COVID. So I mean, we don't know how many homeless people we have walking around that has COVID and they're not being accounted for in these cities. So that could play a role too. Homelessness could play a role, the percentage of homelessness.
Yeah, and let me piggyback off of that in terms of homelessness. Well, my urban geography class, we participated in the homeless count in Nashville because there was a time that Nashville's downtown was gentrifying and it was pushing the homeless people away from homeless services. The men's shelter is downtown, the women's shelter is downtown, the campus for human development is downtown, the homeless medical clinic is down, all of the homeless services, the veterans homeless service, all that was downtown. But when the city gentrified, you had people who were buying $300,000, $400,000 condominiums who didn't want to step outside with their chihuahua and have some guy asking them for change. They didn't want to, can you have some change? No, they don't want to see that person. So Nashville started to use the police as the homeless management agency. And so you start to see homeless people get pushed out into the suburbs. But if you were to ask Metro Council people, do you have any homeless people in your district? They'd be like, no homeless people in my district. And so my class with GPS receivers went out and got the location of homeless people, including the numbers. And we showed that there was definitely persistent homelessness in places outside of downtown Nashville, and that forced the city to move homeless services outside of downtown. Also added to that fact in terms of COVID. So if you've been watching the news, you've probably noticed that, well, Tennessee, the state of Tennessee has no mask mandate. You know, we're no mask mandate in Tennessee. The volunteer state, we're not going to volunteer to wear a mask, right? At least statewide. And so we got shamed. Nashville got shamed on national TV, people walking up and down 2nd Avenue and Broadway, no mask. So our mayor said, we're going to crack down on you non-mask wearing people. We're going to start to give citations, blah, blah, blah. You got to have on your mask, you know, or else. Guess who the only person that got arrested was? One person got arrested during the crackdown. Of course, he was Black and he was homeless. Right? This is the only person that got arrested for not having a mask. And what happened was the police stopped him. He had 3 masks on him. He just didn't have it on his face. Then they saw him a second time without the mask and threw him in jail. This is the only person that got arrested during the crackdown, right? So yeah, that's a shame. I mean, and what was worse, his ID said Salvation Army mission. So it's his ID said he was homeless. Luckily, the media got wind of it and said, you know, come on. I mean, but that's just, yeah, I mean, a lot of the, that's a population that sometimes we overlook when things like this happen. So that's a very good point that you made, Tradarius. If no one else has any other questions, yeah, please congratulate my students. They did a wonderful job. I'm very proud of them. You know, they did a great job. So
amen. They did an excellent job.
Excellent job. Also, don't forget, there's, yeah, if you would, Tradarius, if you mind just taking your screen share off so I can share my screen. So there's even more tomorrow. So tomorrow we have GIS day. Whoops, I hope well, that's part 1. Don't know. Oh, so day 2 of GIS day is tomorrow. You'll probably get another annoying email from me to try to. So tomorrow there's 2 more of my classes that are doing this assignment, and that will be tomorrow. I'll put the Zoom link. It goes to my personal room, so this all goes to the same place. I'll put this in the chat for you all if you're interested in joining us tomorrow. Oops, I need to send this to everyone. Let's see. So there's tomorrow's Zoom meeting. Thank you all. I know everybody is very busy. Thanks for coming. I appreciate our partners in the community-based organizations for coming. Reverend Avant, Pastor Greer, Simone, and Major Womack is here. I'm sure that there might probably others. Oh, the recordings will be available soon on YouTube. Either email me, or I might just send an email blast out to everyone. I'll put my email address. Okay, so my email address is in the chat. And so again, thank you all for supporting our students. Yes, yeah, everyone has, yeah, I just put the invitation for tomorrow in the chat, or yeah, it's up there. Just scroll up for tomorrow. So thank you all for coming again to GIS Day Part 1 at Tennessee State University. Then there's the also the North Star event that's later on this evening. And so I know there's lots of things going on. Again, students, good job. I told you it was going to be a worldwide audience. And again, just one last thing before we go. Well, maybe not. Let me see if I can do this very quickly. I just wanted to show you the additional layers that are on that map, in case you're interested. Let's see if I can get this up here. Right. So I just wanted to show that the, I guess I should share my screen. That would help, wouldn't it? So here's the same map the students just presented. And so if you notice in content, I've added the students' data to various layers, including, here's a COVID-19 vulnerability index by census tract. And so I'm highlighting that layer. And so when we zoom in to say, well, Mobile, Alabama, since Major Womack is here, you can see this is a very interesting map showing us the index of COVID-19 vulnerability by census tract based upon the pertinent data. And so we can click on a tract and see, where these would be, I guess, considered COVID-19 hotspots. And so this is one way to do a hotspot map, not based upon actual data, but based upon indicators. And so the students' data is included on this map. And of course, you can see the variables that they collected here. And so the students should be happy to know that, again, this is not busy work. This is actually your contribution to a much larger project as we literally try to save people's lives. We're going to use these data to some degree to try to push for more testing, COVID-19 testing centers in communities that don't have testing centers. And so you all, again, can use this map, that link to this map in your resume, so that if somebody asks you, have you ever done anything with GIS? Here it is. You can show that to them, and that might lead to an internship. And I know even though you all are freshmen, don't think that you can't get an internship. A lot of organizations and businesses like freshmen because they can have you as an intern for 3 summers before you graduate, and then you're fully trained. And then I had a student actually this summer, this past summer, whose internship went virtual, and she actually was paid. Now it's not about the money. Remember, it's about the mission, not the money. It's mission first, money second. But she did make $8,000 this summer during that internship. And so now is the time to start looking around for those internships, not April or May. And if possible, you might even be working with me with the Gulf Deep South Center for Environmental Justice, because I have a few other grants out there that I will hire students. And since you've done this map, guess where I'm going to look for students to come work with us. So I'm going to end the recording. I know these students are like, class is about to end, Dr. Padgett. So thank you very much to everybody, and enjoy the rest of your day. I really appreciate you giving us your time, because that's 90 minutes that you'll never get back. So that's the most precious gift you can give is time. You'll never get this 90 minutes back. It's gone. So thank you for sharing that with us.